Hello and welcome. Today's topic is our receptors of the body. In our body, there are mainly two types of receptors. First of all, neuroreceptors and then chemoreceptors. Okay. Now, neuroreceptors are visible under microscope, so you can call it microreceptors. Chemoreceptors are visible under electron microscope, so you can say these are nanoreceptors. Okay. Now, the signals are detected by the neuroreceptors are carried by the neurons and ultimately goes to the brain, cerebellum via spinal cord and brainstem. And this chemoreceptors detects the chemical changes in our body. So I will talk about these things ultimately in pharmacological chapter, not here. Now these neuroreceptors are divided into two parts. One is external receptor and there is internal receptor. External receptors are also known as extroceptors. Internal receptors are known as interoceptors. Okay. Now first of all, external receptors. Under external receptors, first of all, you're going to find olfactory receptors. Olfactory receptor detects the chemical components which are floating in air, and when we inhale these chemical components, this is detected by the microcilia of olfactory nerve which are present in the superior meatus of the nose. Second of all, our gustatory receptors. These receptors present in our tongue, and this detects the taste. Different types of taste like sweet, soury, salty, spicy, bitter. Third of all, the receptors present in our retina and the optic nerve endings. These receptors acts for vision purpose. Now what we are seeing, these depends on 5 types of receptors. First of all, photoreceptor, then ganglionic cell receptors, then bipolar cell receptors, then horizontal cell receptors, and then lastly our amacrine cell receptors. Okay. Now first of all, you have to know about that rod cell and cone cells. These things I already talked about in my earlier videos of eye anatomy. Cone cell detects the colors and rod cell detects the dimness or brightness of light. Okay, sensitivity of light, the photon particles. Bipolar cell and horizontal cell detects the electromagnetic radiations. Okay, and horizontal cell and amacrine cell detects the size, shape, distance. Okay. Now in our earlier videos of ear anatomy, I told you that in our inner ear there is our vestibule and cochlea. Inside of the cochlea there is our scala media or cochlear duct. Inside of the cochlear duct there is a special organ which is known as organ of Corti. This organ of Corti consists of stereocilia. Okay, organ of Corti consists of outer hair cell and inner hair cell. And above these hair cells you're going to find stereocilia. These stereocilia acts as a sound receptors. Okay. Fifth component is our thermoreceptors. Thermoreceptors detects the temperature signal. Okay. Thermoreceptors are made by two types of corpuscle. One is bulboid corpuscle and another is cuboid corpuscle. Bulboid corpuscles detects the cold temperature. Okay. And cuboid corpuscle collects the hot temperature or warm temperature. Okay. And the last component is our mechanoreceptors. These are also known as mechanoceptors. Now these mechanoceptors present in the muscle spindle of our entire body. This detects the pressure or distortion of anything, subject, object, doesn't matter. Now there are two types of mechanoreceptors. One is proprioceptor and a nociceptor. Proprioceptor detects the size, shape, area of any object, and nociceptor detects the pain. Now in internal receptors, first of all you're going to find baroreceptors or baroceptors. These detects the pressure presence inside of the arteries and veins. Now example, in our aortic body or carotid body there is our glomus cell. Glomus cell acts as a baroreceptors which detects the pressure changes along with the oxygen and carbon dioxide concentration in the blood. Okay. Now the nociceptor. These nociceptors presents in the internal organ for detection of the visceral pain. Okay. Electroceptors. This detects the electric signals. These are done by the ampule of Lorenzini. Now inside of our skin there is our hydroreceptors which detects the humidity in the air. Osmoreceptors which detects the osmolarity of our blood, and in capillary level presence in the hypothalamus and in the kidney. So see you in my next video. Till then, bye.